What is HIV surveillance data and how do Southern health departments protect it? In an earlier video in this series produced for Southern health departments, we mentioned that HIV surveillance data is part of how health departments detect HIV clusters. This video will describe what HIV surveillance data is and how health departments protect it. Surveillance data at a health department is the relevant medical and other information about people with reportable infections and diseases, including HIV. Laboratories and doctors' offices compile and send this information to health departments as infection and disease reports. The health departments then send these reports to the Centers for Disease Control and Prevention, CDC, which they use to help describe disease patterns and implement effective prevention and care programs nationwide. The CDC receives reports on HIV and dozens of other reportable infections and conditions, such as tuberculosis, foodborne illnesses, cancer, and lead poisoning. The specific information that health departments collect for these reports varies by disease. For HIV, it includes name, address, date of birth, gender, race and ethnicity, related laboratory tests, any HIV medications, and behaviors related to how HIV is transmitted. Health departments remove names and addresses before sending this information to the CDC. Southern health departments collect and analyze HIV surveillance data to help prevent HIV transmission by working to understand the people who are most affected and if or how that may change over time. As discussed in the previous videos, the data allows health departments to monitor disease trends and track clusters and outbreaks, and it can help them evaluate whether their prevention programs are working. Additionally, staff at health departments use this data to contact people with HIV to help connect them to care and assist them with letting their partners know they should get tested for HIV and other sexually transmitted infections. These staff may contact partners directly to offer help with testing, getting on HIV prevention medication called PrEP, or getting into needed medical care. So, how do Southern health departments protect this personal information once it's collected? Each health department may have additional local strategies, but these methods apply to all of them. Legal controls for protecting the privacy of health-related information and preventing discrimination, including state laws related to health department HIV data release. Using software programs that restrict who can access the information. Limiting access to names and other identifying information to people who need it for their jobs. Not disclosing the identity of the person with HIV when a health department reaches out to their partners to offer testing and treatment options. Maintaining a current security and confidentiality policy with regular training for all staff. Health departments protect this information for many reasons, including their policies and procedures require this protection. Health department CDC funding depends on them keeping this information confidential. And most importantly, stigma can harm people with HIV. In addition, all public health surveillance data is collected based on federal, state, and local laws and regulations. Surveillance data does not require individual permission because it is acquired and used only for legitimate public health purposes, including efforts to prevent disease and early death or promote community health. Therefore, health departments must protect it. Reliably and consistently protecting public health data from disclosure is essential to any effective HIV surveillance program. Trust is vital to any health department's ability to collect accurate data, and they take this responsibility seriously.